Hi, everyone. Thank you for joining us. My name is Michael Stewart. I work with the OI Foundation as the Director of Education. Thank you for joining us for today's session on best practices for qualitative reviews and PCOR or patient-centered outcomes research. We ask if your microphone is unmuted, please mute your microphone now by clicking on the mute button in the lower left corner of your screen. Thank you so much. We're going to try to keep today's session as brief and to the point as possible. Again, we're going to ask everyone that during today's session, if you have any questions, you can please put them into the chat bar, which I see Rachel has already started. And if you have any questions at any point during the session, you can put them in there. And then when we will get to them near the end, when we have our question and answer period. Again, I want to thank everyone for coming to today's session on the OIF's PCOR project. And with that being said, I'm going to introduce Dr. Laura Tosey.
Thank you, Michael. And welcome to everyone who's attending today. This is our third, and for this tranche, final session as we work hard to help everyone do the best possible patient-centered outcomes research. We're really delighted to have you here today. And hopefully we will add a little time for discussion at the end, because I haven't been doing a good job getting input from you all. This is a magic day for me. I get to introduce Teri Swezey, who is like a genius at interviewing, which can be a real challenge to do well. And she knows a lot about OI because she actually, I guess it was 2 years ago, came to the International OI meeting where we did some qualitative interviewing. And it was fascinating to watch this woman in action. So with that little introduction, it gives me great pleasure to introduce Teri Swezey. Teri, go ahead.
Well, thank you so much, Dr. Tosey, for that very glowing introduction. It was my pleasure to be able, and my privilege to be able to attend that International OI conference. And also I had the opportunity to attend a national conference, I think about a year ago, maybe 2 years ago now. And so I tried to incorporate some of what we learned at these conferences into the examples that are part of this presentation as they relate to adults who have OI and the types of concerns that they raised at these conferences that are germane to them. So they're examples of what they would like to see more focus on in research. And I should say that this presentation builds upon the presentation that my colleague and our fearless leader at Qualitative, Amy Cornelia, gave a couple of weeks ago, which was about qualitative research methods and analysis. So you'll see some familiar material, but I'd like to thank Amy for allowing me to use the slides that she presented as kind of a template. All right, so this is about best practices for qualitative interviews and PCOR research. We're going to jump right into it here. So the goal of the session in terms of learning objectives, at the end of it, you'll be able to define in-depth interviews. You'll know some effective skills, some skills for effective interviewing. You'll understand how to build rapport during an interview, and you'll also know how to ask open-ended questions and probes. And part of what we'll be doing is talking about how to essentially transform closed-ended questions into open-ended questions and probes. And also you will be able to describe strategies for avoiding 3 of the common pitfalls in qualitative interviews. And as I mentioned, this is based upon Amy's presentation, so this is a recap of what she talked about in terms of what are in-depth interviews. Importantly, in-depth interviews explore an individual's perceptions, practices, beliefs, and experiences about a specific topic or event. I know that Amy talked about there are basically 2 avenues of qualitative research. One would be focus groups, which is focus more on group norms and values. And the other one is what we're talking about here, in-depth interviews. And it allows you to really dive into the person who you're interviewing, their experiences, their thoughts, and their perceptions, and to allow them to be the expert, and in fact, to recognize that they are the expert and that you're really there to learn from them and their experience, because they have a great deal to teach us. They're flexible such that a priori topics can be explored. So you've got an interview guide, you know that you want to cover certain domains, and those are the a priori topics. But also, as you're having this conversation with somebody as part of an interview, you can, if they say something that is relevant to the topic of interest, you can ask probing questions, follow-up questions in response to try to help them draw them out. And so that's the flexibility there, as long as it's within the overall research topic. You don't want to be going down any rabbit holes that are unrelated to your research topic, no matter how appealing they might be. You need to be focused on, let's keep to the topic within the domains of the research objectives. So they're often, as Amy mentioned, used to explore sensitive topics. And what you get out of them is very in-depth info about individuals' perceptions, practices, beliefs, and experience about whatever topic or event that you are exploring. So now we're going to be going over some of the best practices for how to be an effective qualitative interviewer. Specifically, we want to think about what skills are important for an effective interviewer to have, why is it important, and what can you as an interviewer do to carry out particular skills. So qualities of effective interviewers. Effective interviewers are knowledgeable about the topic. They know their interview guide up one side and down another. It's really, really important to have, in my mind, in my experience, to have internalized that guide. You don't have to stick to the guide. There is a flexibility in an in-depth interview that if somebody is talking about something that comes up later in the interview and you want to, it seems like a natural place to ask that particular question. If you know your interview guide well, you can ask that question. But if you don't know it well, you're going to be thinking to yourself, gosh, I'm pretty sure that's covered, but I'm not sure. Let me look at my guide. And that kind of interrupts the flow. So you need to know your interview guide. Also, practicing interviewing, practice, the interview guide. And also, we really encourage you to practice the interview guide with a partner so that the person can play the role of a participant. And then you can switch and they can interview you and you can experience being asked the questions. So that's another way to really get a feel for how to interview. And that will also give you some idea when you're practicing about places that you might encounter problems in the interview guide. And additionally, there are a set of key skills that you need to have. In patient-centered outcome research, interviewers need to believe in the importance of the participant perspective. Need to demonstrate a neutral attitude and not show expressions of that suggest approval. You don't say things like, oh, that's great, because then the participant may feel that they need to tell you other things that will encourage you to give them more positive feedback. Likewise, you don't want to show expressions of disapproval, judgment, or bias. You allow the conversation to develop naturally. I really feel that good qualitative interviews, effective qualitative interviews, are like a conversation. Granted, when I'm doing an interview, I'm the one who's asking most of the questions. But if you can establish early on in the interview kind of a conversational give and take flow, it will really help the participant to feel much more at ease and encourage them to open up. And that's also just part of building rapport and respecting the principle of the participant as expert. That is key. And you want to be able to listen attentively. And when you're listening attentively, you are showing ways that encourage the participant to continue sharing. In other words, active listening. Additionally, you adapt to different personalities and emotional states. For example, I'm a person who really likes eye contact, but there are a lot of people who are very uncomfortable with eye contact. And it's pretty obvious in the beginning of an interview if you're interviewing somebody who's very uncomfortable with eye contact. So for me, I never try to get them to give me eye contact because it's about them and making them comfortable, not making me comfortable. And so I don't want to try to draw them out with my eyes. I find other ways to draw them out. Some people, in terms of emotional states, some people might give very kind of flat responses. Yes, no, very short answers. They don't elaborate a lot, but you can also draw them out. And I've also found sometimes with people who start out an interview and they're in a more of a flat affect kind of emotional state, and they really warm up towards the end of the interview. One of the key things is people appreciate being asked about their experiences, of being recognized for the value of somebody asking them, somebody learning from them. And I think that contributes to them opening up more towards the end of the interview. You want to keep a calm tone of voice and use positive body language. Of course, this is more like from when we were doing in-person interviews, which I hope we're going to be able to go back to. But you want to have an open attitude, a pleasant mood, and show sincere interest. You also want to build rapport. Rapport is key. So how do you go about building rapport? How do you start the interaction? What can you say or do to make the participant feel relaxed? One of the things that we do, and that we'll be talking about in a little bit in our interviews, is we start off the interview by explaining the kinds of things we've already talked about, that the participants' experiences are what we're here to learn from, that there are no right or wrong answers, and that if they have negative views or opinions, they're just as important as positive views or opinions. And we really encourage them to feel as comfortable as they can in being open with us. But we also have to understand and respect that some people, may not feel completely comfortable being open, but at least we try to build rapport early on in the interview so that the stage is set for that. So if the conversation becomes tense, what kinds of things can you do to make the participant feel comfortable? Some of the stuff, because in-depth interviews do talk about sensitive information, and some of the stuff can bring up emotions for people. And I think one of the things that you can do if somebody starts crying is just be present with them. Just let them have that moment. And then when they stop crying or they feel like they've calmed down a little bit, ask them if they'd like to continue the interview, and then move forward from there. And if depending on where that person is at emotionally, you could try to ask them about what they're feeling, what's making them feel so emotional about this, but it's really a judgment call on your part. And so what can you do to make a participant feel that he or she can trust you? And importantly, what parting words or behaviors will help the participant leave with the feeling that he or she had a positive interview experience? I've already talked about some of this, but you want to communicate in terms of tips for building rapport. You want to communicate with participants that they are the source of knowledge and experience, and your role is really to learn from them. And this, I want to point out, does not mean that everything that the person says in terms of, yes, they take their medication, they're adherent to taking their medication, or whatever else, that maybe perhaps that they're not so adherent. We're not interested in what, whether or not what they're telling us doesn't match the medical record. We're interested in what it is that they tell us and how they explain it. What is their narrative and what is their story? And so, as I mentioned, you want to let them know that they're the experts. We're learning from them, emphasizing there are no right or wrong answers, and that negative views are as important as positive, and also to express your appreciation for what they've shared, and that it will help us to better understand the study topic. We build in at least a few thank yous after each section. We thank the participant for telling us the important information and experiences that they're sharing with us. And at the end of the interview, we always thank them for sharing their experiences and their insights, and it will help us to move forward with a particular topic that we're studying. And so now we're going to talk about 3 common pitfalls in qualitative interviews. The first one is frequent use of closed-ended questions. Open-ended question for the hallmark of qualitative interviews. Sometimes you do use closed-ended questions, but qualitative interviewing is to get at experiences and thoughts and feelings and opinions, and you don't get any of that if you ask a question that's like common closed-ended questions. Did you or do you, were you or are you? You're going to get yes, no responses, and that tells you absolutely nothing. Drawing upon what some of the people at the conferences that I was lucky enough to attend talked about in terms of concerns for adult patients with OI, some common closed-ended question examples would be, do you attribute the GI issues that you experience to your pain medication? Another question might be, are you experiencing any pulmonary or respiratory symptoms? And the third question might be, is it a challenge to deal with the fatigue that you experience? As you can see, each of these questions only gives you yes or no. That's it. What we're trying to encourage is that you want to kind of turn these questions on their heads and transform closed-ended into open-ended questions. Some common open-ended question starters are like how or what. So taking those three previously closed-ended questions, transforming them into open-ended questions, they would be, what do you think contributes to the GI symptoms that you experience? Each of these examples of open-ended questions here, you're going to want to ask follow-up probes and follow-up questions. But as you can see, these questions open up the stage for the participants to talk about their experiences. The second question might be, what kinds of pulmonary symptoms are you experiencing, if any? And third question would be, how tolerable is the fatigue that you experience? Well, sometimes in qualitative interviews, we ask mixed questions, which is asking a closed-ended question followed by an open-ended question. So probes are things like, what makes you feel that way? Tell me more about that. How so? So if you did ask that closed-ended question about, do you feel like the pain medication that you're taking is contributing to your GI symptoms? And they say yes, then you can ask any of these three probes and more to try to draw them out. I personally try to stay away from asking why, single word question, why, as a probe, because I think that it can potentially put people on the defensive, and that's not a good dynamic. That does not build rapport. People might feel like they're being asked to justify their response. And how so is a very similar question, of why, but I think that it is a better probe than why. So as I mentioned, typically open-ended questions always follow closed-ended questions. So why would you even ask the closed-ended questions in an in-depth interview? Because you want to avoid making assumptions or leading participants. They're often opinion type of questions. So first, just we've talked about, ask that closed-ended questions and then follow it up with open-ended questions. And also you're specifically interested in the topic. For example, one of the things that people at the conference have talked about is the impact of hearing loss on adult OI participants' quality of life. So you could ask, if you were going to take the kind of mixed approach, you could say, if you know that somebody does have hearing loss, ask them whether or not a question like, does the hearing loss that you're experiencing affect the quality of your life? They say yes or no. If they say yes, you could ask any of those probes, tell me more about that. How does it affect your quality of life, etc. So we like to ask the broad questions first, like how, if at all, has hearing loss affected the quality of your life? And then see if the participant, what kinds of things they talk about, and then ask the more specific questions afterwards. If they mentioned it on their own, then that's a sign of salience. Another question might be to get at how important hearing loss might be. You could ask them, what kinds of things are, what kinds of symptoms that you're experiencing affect the quality of your life? And if they mention hearing loss, then you can come back to that and ask more direct questions. And so if the topic isn't mentioned, but you know that you need to cover it to achieve the objectives of the research, you ask a direct probe. And you can always, at the analysis stage, figure out when participants mention this topic spontaneously or when they mentioned it only with probing. So the second pitfall is asking ineffective questions. Only ask one question at a time. You're verifying unclear responses. You're asking open-ended questions. You're avoiding biased questions, stigmatizing questions, and leading questions. And you're asking follow-up questions, probe, and probe some more. So you want to avoid asking double-barreled questions. And an example here is in thinking about your chronic pain, what is a good day like for you and what is a bad day like? It's two questions in one. You need to break it up into two separate questions. Ask one question at a time. In thinking about your chronic pain, what is a good day like for you? And how about the flip side? What's a bad day like for you? Another approach is to prepare the respondent by saying, in terms of your chronic pain, I'm going to ask you about what a good day and a bad day is like for you. First, I'm going to ask you about what a good day is like, and ask them about the good day, and then say, and so now tell me about what a bad day is like for you. So we always want to verify unclear responses. Never assume that we know what somebody is saying. If we're confused about something, chances are that when the transcript comes back, you're still going to be confused. You need to ask for clarification. An example of this is that in much of the research that we do, we interview providers, and I am not a medical provider, and I'm familiar with the topic, but I'm still not a medical provider. And a lot of times the providers are saying things that I have no clue what they're saying, even though I've read up on it. And so whenever that happens, I always, one of the ways I build rapport with providers at the beginning of the interview is to say, I'm a social science researcher, not a medical provider. So some of the questions I ask may be very simple to you, very naive, but we just want to make sure that we really understand what you're saying. Because if somebody is using very technical language and you get the transcript back and you don't know what it means, you're going to have real problems. And people are respectful about that. So you can ask them to clarify what they said. I'm sorry, could you repeat what you just said? I didn't quite hear you. And then you can also reflect the answer back to the participant, especially if they're giving you a narrative that is long and very complex and very rich, and you want to make sure that you really understood what they were saying. You can kind of summarize by asking, so you think the pain medication that you're taking causes your GI symptoms? And that will, help. They'll say yes or no, or they'll say no, what I really meant was this. And that will really help to clarify things. And you need to have that clarification at the analysis stage. So we'll also ask open-ended questions. We keep coming back to this because it's so important. So example of closed-ended question would be, do you feel pain when you wake up? Yes, no. Turning that around on its head is an example of an open-ended question. When do you feel pain during the day? Now, if you're specifically interested in whether or not they feel pain in the morning, you can probe after they've said, yes, I feel pain during the day. What kind of pain, if any, do you feel when you wake up? So also avoiding biased questions and comments. And such as, do you take your medicine that the doctor prescribes? Are you most bothered by fatigue or by your other symptoms? Do you agree that it is important for orthopedists to ask adult OI patients about bone fractures at every visit? I also want to avoid stigmatizing questions, and I hope questions will never be asked during an interview of any kind, but there are really good examples of really stigmatizing questions. Don't you worry that you will gain too much weight because of your high-fat diet? Why do you not exercise when you know it's good for you? So avoid asking leading questions, such as, Did you not take your medication as prescribed because you want to avoid its side effects? That's basically giving the participant the answer that you want. And you don't want to be leading them like that. So you can ask, for what reasons, if any, have you missed taking your medication as prescribed? So the third common pitfall is limited probing, or asking limited follow-up questions. What are probes? Probes are like neutral questions, phrases, sounds, or gestures, and they're used to encourage the participants to elaborate upon their answers and to share more. You use probes when the participant's response, as we've talked about, to your question is brief or unclear, when they seem to be waiting for a reaction from you, and when the participant seems to have more information on the subject. You don't want to miss that opportunity to learn more from them. Also, as I've talked about, don't assume that you understand the intent of a brief response. Ask yourself, do you think that you have a full understanding of the issue? Talking about interviewing patients, for example, they may also say very technical things. And again, I may not have any idea of what they're talking about. So I always ask follow-up questions to make sure that we really understand what they're talking about and what their experiences are. And as I've also mentioned, will the analyst or the investigator understand what the participant is saying when reading the transcript? Because you can't do a do-over, and you just want to make sure that you really have a good handle on things. There are different types of probes. There's passive, indirect, and direct probes. Passive probes are like in a conversation, when you're having a conversation with somebody and you say, or I tend to say gotcha too much during interviews. When you're doing an in-person interview, you're nodding your head, you're being silent because you're not going to interrupt their narrative, their story, or you're making eye contact if the person is comfortable with eye contact. So indirect probes are when you say things like, you mentioned X, so tell me more about that. What makes you feel that way and how so? These kinds of probes, any of these probes, show that you are listening attentively, that you're using verbal or physical expressions. Direct probes are related to your overall research questions. They're concepts that the participant has not yet discussed, but that you're interested in. I've talked about participants that might start out an interview and they just give a very comprehensive answer to pretty much all the questions in the interview guide on the first or second question. And yet they may not have answered a few things. You want to be able to both take little notes about what they've said, but also what they haven't said that you know that you need to capture during the interview process. And so they're typically open-ended questions. There's a mix of closed and open-ended questions, and they're used to clarify meanings and learn more information. They also explore different sides of a particular topic. And now we're going to talk a little bit about how do you take better notes during in-depth interviews. Limited probing can also come from ineffective note-taking. If you're not taking any notes during an interview, then and the interviews tend to feel fairly intense, you're going to be thinking to yourself, I know that they said something about this, but I can't remember what they said. And then you're going to have to be racking your brain during the interview, and that's going to be very disruptive to conducting an interview. It feels like more of a natural conversation. So you just want to take, in whatever method you use, brief probing notes during the in-depth interviews. And the primary purpose is to act as a reminder to yourself about what you need to probe about. And your notes can also be helpful if the audio recording doesn't work or parts of the recording are hard to hear or understand. When we have our interviews transcribed, we frequently get back from the transcriptionist company a lot of inaudibles, and that they couldn't figure out what was being said. And if you don't have any notes, it's very difficult to go back in and fill those, listen to the audio yourself, and try to fill in those blanks so that you don't have 80 inaudibles in one interview. And so how do you take the brief probing notes? You write brief notes on the question guide, or if you prefer to use a notebook during the interview, you just want to write enough information, cues, phrases, to help you to remember what the participant said so that you can follow up and find out more. Just like 1 or 2 words or whatever shorthand you use to take notes. And you want to be quick and consistent because note taking can be distracting. And that's especially true during in-person interviews. There's nothing more disconcerting to the person who's being interviewed than to have you like, oh, wait, I'm just taking notes here. And the same thing, it's almost in some ways a little more awkward when you're doing a phone interview because they can't see that you're just taking some notes, and it's really breaks up the flow of the interview. So here we have some examples of a question that was asked, what a participant said, and the kind of probes that would be useful to help to draw them out. So the example is, what were your experiences like at the ABC Health Facility? And the participant said, well, I didn't like it at all, not at all. So I went somewhere else. I liked it there much better. I think I will continue going there in the future. I'm going to stay with it. And so you can see the notes that the interviewer took over here. Didn't like the services, went somewhere else, and is going to stay there. So in terms of the probes, first, they didn't like the services. A follow-up probe would be, what did you not like about the services at the ABC Health Facility? And with all of these examples that we're going to be giving in terms of probes, you would very likely need to ask more additional probes based upon their responses. You take your cues from what the participant is telling you, and you follow that thread as long, again, as it is within the domains of your research objectives. The second statement that the participant said is, I went somewhere else. And so the follow-up probe could be something like, where was the other place that you went instead? And you could ask, what did you like about it? And then you could ask more follow-up questions related to that. And maybe somebody, if you ask where was the other place that you went to instead, maybe let's say they feel like, I don't want to tell you where it was. And that's perfectly fine. You can ask them that follow-up question. So what'd you like about that place? And draw them out about what they liked about it. To get at what was it that made that place feel better for them. And then the third one, I'm going to stay at that place. I like it. I'm going to seek my care there. You could ask, for what reasons do you think that you will continue to seek care at this place? And again, you probably have to ask more follow-up questions. And I believe that that's it. As I mentioned, these slides were modified from a workshop originally developed by Amy Corneli for the Duke University Department of Population Health Sciences 2019 Summer Institute. And that's it for the slides. I thank you very, very much and would welcome any questions. And I'm gonna, should I stop sharing now, Michael?
You can leave it
Okay.
there, that's fine.
Okay.
So if we have any questions from the audience, we're a relatively smaller group today, so if you want, you can either type them in or you can unmute yourself and just introduce yourself and ask your question.
Yes, I think that's a great plan. And do you want to switch to photos maybe, or images? I hate looking at the word questions.
Oh, sorry.
All aboard. Yeah.
Let me just, well, if I exit, I mean, I think I just, now, let me just go back up to the first one. Would that be better? Like one of these guys?
I think you can just unshare.
Unshare? Okay.
That's a little friendlier.
All right, I like it. All right, I stopped.
There you go. Now we see you.
Yay.
Good plan.
Teri, this is Tracy Hart. Hi.
Hi, Tracy.
Hi. I have a question for you.
Yes,
so when you're talking about interviewing, qualitative interviews, is it always one-on-one, or is there ever a group setting that you do, or?
That's a great question. Typically, in-depth interviews are one-on-ones. But I believe I'm going to defer to Amy here. Have we done? Well, let me take that back. There are dyadic interviews where you have two people.
Okay.
And in those situations, for example, I believe that our group, I'm going to let Amy talk about this, but we've done interviews with veterans and their caregivers, for example. I'm going to ask Amy to speak to that.
Yeah, well, there's definitely dyad interviews where you want to get, usually it's a caregiver and a patient dynamic, but it doesn't have to be, or sometimes it's a couple, and you want to have both sides of the perspectives in an interview. So dual interviews happen. Teri's right that most of the time they're one-on-one. The dual ones can happen. And then we've also done what we call group interviews. So it's not as much as a focus group. You don't have those 6 to 8 people, but you have like 3, maybe 4, 3 people-ish in an interview. And it's when, like, we do that a lot when we're talking to professionals, actually,
Yeah.
when like you're talking to a study team, and so you want to have the investigator and then maybe your study coordinator, maybe your regulatory person or something like that, where to get the full picture, you kind of have to have different players there because they each can add to the main point. And so it's easier just to have a group interview, and it's just different from a focus group discussion. And so we do call them group interviews. We don't do those too often. They're really pretty specific to the overall objective, but those are variations that can happen.
Yeah.
Amy and Teri, can I pull you out on that? So,
Sure.
in fact, when Teri and I went to Oslo a couple of years ago, we did do a focus group. How do you see the difference between this in-depth interviewing and a focus group in terms of what you can get out of it? And I'm asking this question in the context of our really trying to make sure we're answering the questions that the OI community wants to know the answers to.
Mm-hmm. Well, a focus group is really, as when we were in Oslo, and also I believe when we were, where was it, Chicago? Where do we have that? I'm forgetting the national conference location. Oh, it was in Baltimore.
That's right.
Yeah, that's right.
When we had that session with OI and wanted to draw them out. And so what you're trying to get there is really what is important to the group. What are the group values? What are the group norms? It's not in in-depth interviews, you're able to ask about sensitive information. You don't ask for example, in a focus group, you're not going to draw out somebody about their experiences with GI effects, because that's a personal, that's personal information that's better expressed during and better explored really during an individual interview, in-depth interview. And you're not, in a focus group, you're not trying to get at individuals' experiences. You're really trying to get at group experiences. What you talked about is what is important to the OI community. So as a group, what's important to them. But you don't want to get into the individual details because you're not in a focus group, because you're not going to analyze it at the individual level. You're really analyzing it at the group level. And Amy, would you add to that at all? No? Okay. She taught me well.
Teri, I don't want to hog the question, so I'll just ask one more. But when you're doing the one-on-one interviews, how do you compensate for bias? Like somebody who's coming with predetermined opinions, or do you know what I'm trying to say? Or doesn't that matter?
Well, we're interested in their opinions. We're interested in their thoughts. If they've got bias, it's going to come out in the interview. I remember doing some interviews with people who had very traumatic accidents or something that required their lower leg to be either amputated or potentially amputated. And one guy in particular went down the road of Trump. I mean, really went down the road of Trump. And yeah, that's an opinion for sure. But it wasn't relevant to the interview. And so I found very gentle ways to kind of steer it. And he wanted to rope me into his bias. And I was like, not having any of it in a very nice, friendly way. So if somebody does come, let's say somebody does come, and for an interview, for example, with an adult OI patient, I believe that one of the things that we learned at these conferences, particularly the Oslo conference, is that adults have different experiences of their OI and symptoms and things. I remember in particular people talking about aging, things that they're concerned about aging, or women's reproductive and reproductive health throughout the life cycle kind of things, or that they're just tired of the focus on bone fractures. I think that came through so clearly, and great, we want to know that. They can come bring their opinions. We will be able to deal with it. The important thing is that the interviewer not present or respond to those biases. Oh, that's great that you feel that way. No, you just let them tell their story.
Got it. Thank you.
Amy, would you add?
Well, yeah, and just to add to that, I mean, the whole point of an interview really is to get their experiences and their perceptions. And if they have some bias about, let's say, a topic that's related to the interview, that's okay because it's their perspectives and their experiences. And you may find, if you're hearing it from a lot of your participants, this bias, well, that might show you that there needs to be, and it's wrong, or it's something, maybe there needs to be more education, or who knows what it is. But again, interviews are about finding out, these are people's perceptions and experiences, and we take it all in because that's where they're living. That's their viewpoint on things, and that's what we want to find out.
And people generally, one thing that happens in qualitative interviews, and I've seen this in both international research in sub-Saharan Africa as well as the domestic research here, is people are generally pleased to be asked to share their experiences and their thoughts and their opinions. It makes them feel valued, and they are valued, but oftentimes they don't get asked questions. And so about where are they coming from? Well, they get asked questions that's like off a standard form, but they don't get asked about tell me about your experiences. And so they really open up, and that's that opportunity to hear their story and to learn from them.
One of the things you've mentioned repeatedly is the interview guide.
Yes.
Can you talk to us a little bit about what that means to create?
That would be a whole nother.
I know it would, but give us the short burlitz on that, please, just to get us started in our thinking.
Yeah, I might bounce this to Amy, but I'll say my little bit, but she's the person who's very intimately involved in developing guides. Myself and other interviewer analysts generally provide feedback after it's been developed, but in developing an interview guide, you need to be guided by what are the research objectives. And you decide, when you look at the research objectives, breaking it out in terms of what are the domains of interest that you want to get answers to that relate to your research objectives. And then you can start asking questions about, or drafting some questions about them. And you developed, I'm going to let Amy talk about this, a research grid. And it could be like, here's the domain of interest, maybe here's the major theoretical framework that guides the kind of thinking about the questions that we want to ask and why it's important. And here are some draft questions. And we often, we work with, at Qualcore, we work with clinicians oftentimes who are very, very used to asking close-ended questions. That's more of a norm for them. And so we often have to work with them about, let's turn your close-ended questions into open-ended questions here, and really focus. So you want to have a guide that asks those open-ended questions, that covers your a priori research objectives, so that's guided by that, so you know you're going to be getting the information that you need to get, and also that's not a fishing trip. So you're not, gosh, there's all kinds of information that would be wonderful to know, but that's not what the study is about. So you need to keep it as focused and as tight as possible. And also, generally, we go through a lot of culling of questions when we're developing guides, because you've got to be able to do that guide within the allotted time. You do not want to take advantage of people's time. So you're not going to be asking 50 questions in a qualitative interview. You're going to be asking a very tightly structured set of questions. And questions may arise from the questions you asked. That's what we were talking about, the probes. So you're going to be asking more questions than are actually on the guide, but they're going to be related to your research topic. So Amy, you want to?
I think you did a great job. I mean, the main thing, as Teri pointed out, is you got to ask what you need to know, not what's nice to know. You know, we're all scientists, we're all curious. And so there's all these things that are related or somewhat tangential and we want to know, and that kills your interview. And so everyone we work with in all of our own studies, we do this domain map, this domain grid, as Teri mentioned, where we look at the study objectives and we list out maybe 5 domains that are going to help us answer that question. And maybe there's little subdomains with each one of those. And then our grid goes on to what questions are linked to that. And we make sure that every question we ask, we know why we're asking it and what is it going to answer. And lots of times then we're realizing we're going off mission. This is just out of scope. And then it also lets us know what we may be overlooking as well. But it gives it focus. You're not asking a million questions all over the place. And so we highly, highly recommend doing something very structured like that when you start your guide.
It also, as I mentioned, the practicing the guide is very important, because when we practice a guide, we generally do, at least if it's us, just a trained interviewer analyst, we'll do at least 2 sessions of practicing. If it's somebody who we're training, we'll do a lot more sessions with them until they feel comfortable with it. But one of the things that happens in those practice sessions is you realize you're reading out the question and you're like, I don't even know what this means. And so you can take notes and get clarification from the PIs, or you can trim up the language so that it's a lot tighter and less ambiguous. So we often make changes. We try not to add anything when we're at the practicing stage, because a draft of the guide's already been approved by the IRB. But if we have to delete things, we're comfortable deleting things or slightly changing the language. It doesn't have to go back to the IRB for that.
And so what we do is at the investigator level, we make sure that all those domains are in the guide. We're asking all those type of questions that we know is going to will answer the objectives. And then when Teri comes in, it's like, okay, what is it like when you're actually saying those out loud? Because what might sound good in a theoretical point of view is not really going to fly when you're trying to have a conversation. So they really, we try to do it the best we can to make it conversational when we work on them as investigators. But then always, once you practice, say these things out loud, have people really answer it, have people try to really understand what you're saying, we absolutely continue to make modifications on it. And then it really gets it to be a better guide when you first start out.
Yeah.
So as you know, we're trying to use PCOR, a concept of PCOR, as well as ultimately our patient registry, to try to answer some of the questions that adults have. I think our natural history study is really capturing the kiddos pretty doggone well. But the natural history of this disorder is changing very quickly. The adults are speaking up. But it's like there's a whole huge world out there. Can you give us some examples of other groups you have worked with and how they've used your methodology to be successful in answering community questions? That's a toughie, and it's very broad, but sort of what are some of the projects you've worked on, and what are you proudest of in terms of what it led to?
Amy, I'm going to let you run with that because you can speak to the people we've worked with. I would say that we work with them as they come to us and they have something that they want to explore, and then we are the people who work with them to develop the guide. And then generally, unless Amy is somebody's mentor, we're doing the interviewing and the analysis and the write-up because that's what we're experts in. And sometimes though, when we're training people, they get trained in how we train them in how to do qualitative research. Amy, I'm going to let you take it from there.
Okay, we do a couple things. So for some of our studies, mine and some other investigators, they're already working with advocacy groups, community groups, patient groups, and coming up with some of those questions together. And then we write the grant together, then we get funded to do it, and then we work together as we develop the guides. They review the guides, they're part of developing the questions, and then we spend a lot of time really honing in those questions. And for some we work with some clinicians, and they've been working with their patient population a really long time. They have a lot of questions that they think will help them be a better provider. And so we help them, they talk about what they want to learn about to help them be a better provider. What information do they want to get from patients to do that? So we help them figure that out and write those questions. And then we also work with some folks, and we do this too, where you're collecting data and then you work with a patient group that you've developed to help apply those data. So you're collecting a bunch of data on a certain topic. You want to use that to develop an intervention. And so you have a community group, a task force, a coalition, all those different words you want to call them, that think through those data with you and then apply them to some intervention that you're going to do next to try to, intervene on whatever that outcome is that you're trying to change.
Can you speak to a specific, I don't think we're bursting into privacy, but an example of a disease entity, a syndrome or whatever, where the interests were and how you solved that problem in a little bit more detail? Just a more focused example is all.
Yeah. So, I can give two. So one of a colleague who we're working with who works in lupus, she's a lupus provider, and she wanted to figure out how to help lupus patients better adhere to their meds. There's a lot of data out there that medication adherence isn't great, and people need to adhere to their medicines to have better health outcomes. So we collected data on the barriers and facilitators to adherence among select patients. We talked to the providers about what they thought were the barriers, and then that investigator used all that information in terms of these barriers and facilitators and had I forget what she called it, but it was a coalition of sort where she met with them multiple times. She presented the data. They talked about, well, what are adherence interventions that can be done, and then she was focused at the clinic level. So what are adherence interventions that can be done by providers to help, or at families, actually, she was looking at the family level too, that can help patients better adhere. And then she writes an intervention, and then the next grant is to actually do the intervention and evaluate it. One thing that I'm doing right now is we're collecting data from Black women on pre-exposure prophylaxis for HIV prevention. What are ways, so Black women are at increased risk of HIV, and there's drugs out there that can help reduce the risk, but they're not using them very frequently. So we're collecting data from Black women on those barriers for it, and then we have a task force of Black women who are going to look at these data and come up with community-based strategies for trying to help Black women use this medication more often. And so it's really presenting the data and then use that expertise from those community groups, because they have, we bring in the science that has perspective of patients as well, and they bring in their daily experiences and what they know on the ground that might work or might not work. And then together you are able to develop something that has a shot of working, and then you try to evaluate it.
Terrific. I've been hogging the mic. Please, everyone, feel free to unmute if you have questions or opinions or anything else. I don't want to hog. All right. Well, what I'm not good at is getting our attendees to speak. First, I want to thank you guys. This was a terrific session today. I think interviewing is hard for all of us. But if we're going to ultimately do a good job at our mission, somebody like me has to learn. That's all there is to it. For the folks on the call, one, if you have colleagues who have missed out on our events, please remember that the good Michael is in fact recording them all, and they are on the OI Foundation website. The next thing we're going to do. So this is sort of the summer event finale. But the next and perhaps much tougher step forward is going to be, how do we work together? And how do we leverage the OI Foundation's registry? How do we leverage what so many of you are already doing? We don't want to reinvent the wheel anywhere, and we want to start to answer questions like, how can we be helpful? So the hard thing is finding a time across all our time zones, et cetera, et cetera. And we will be sending out a doodle poll, hopefully within the next few days, probably to do something fairly late at night for those of you on Eastern time, so that we can be nationally inclusive, because we have to make it possible for everyone to participate. So, last chance. Again, Teri and Amy, I cannot thank you enough. It is such great fun to try to probe this very challenging future for our work. But with luck, as we keep saying, it's the 401k of OI research that we're invest slowly but steadily. And with luck, we'll answer a lot of questions for a lot of people over time. So it's always good to end right on time. Thank you again, everyone, for participating today. And we look forward to a robust and interactive meeting, hopefully in a few weeks. Great.
Thank you so much.
Bye.